Thank you very much. I'm very happy to have opportunity to see some very familiar faces, some of my friends and colleagues all over the region. Thank you for joining us today on this very relevant topic. Maybe we are overwhelmed during the 16 days of activism, but we were talking about SOS helpline fundings or about investments in combating gender-based violence, considering this one as a crucial in gender-responsive budgeting. In other words, we consider that without increased funds for combating gender-based violence, we cannot talk about gender-responsive budgeting or budgeting that recognizes needs of women. Can I just ask Ivana to move slides? Because, okay, thank you. So as always, when we are doing gender-responsive budget analysis, we are starting from policy framework or legal framework or obligations that states have when it comes to gender equality or more specific objectives, like in this case. When it comes to SOS helplines, we started from Istanbul Convention that majority of our countries ratified. So it is mandatory for them to apply it or to implement it. And it is grounded, first of all, it is grounded, first of all, about adequate and appropriate financial and human resources for implementation of the policies. I just want to make one note here that SDG 5C1 indicator under the SDG 5 is also measuring investments in gender equality, starting from the policy framework and then our funds allocated for specific policies, sufficient or not for its implementation. Istanbul Convention and Article 8, first of all, the parties need to allocate sufficient funds, and then they need to recognize non-governmental actors or organizations and civil society as very important actors in providing services or in general in combating all forms specifically related to women's organizations. And when we are talking about different approaches, women's organizations are those who have feminist approach towards combating gender-based violence and providing services to victims. And in that sense, they were first who started to work on providing services to women. So they are really like the most important non-state actors that needs to be taken into account and recognized. And also Article 24, that is the most relevant for our topic, that parties shall take necessary legislative or other measures to set up statewide round-the-clock telephone helplines free of charge to provide advice to callers confidentially or with due regard to their anonymity. This is specifically related to SOS helplines. We can go further. And then our question here is, are the states, are there SOS helplines established at the level of states? Then we have what is also relevant is that we realized that we think, as a Gender Budget Watchdog Network, that combating violence against women and girls is a first priority in achieving gender equality, especially having in mind the number of femicides and cases of violence against women. Then that we cannot talk about gender-responsive budgeting without increased funds, as I said. And also, we cannot talk about accountability of women's movement without data about allocations in combating gender-based violence and also support to women's organization. It can go not only to SOS helplines, but also it is relevant for funding of women's organizations in general. We did this pilot methodology and pilot assessment back in 2022 related only to SOS helplines, but we want to expand it to the entire scope of combating gender-based violence, including also police, including prevention, including education, including safe houses and shelters, including prosecution, protection of victims, work with perpetrators, or any other policy and legal obligations that are in place and that need to be implemented fully. Then we also have this intention, to make it wider. We can go further. Thank you. So we had these three pillars that I presented from Istanbul Convention. So are there appropriate financial and human resources? Is there recognition and support to relevant non-governmental organizations? And are there SOS helplines? We have these results, so fully fulfilled, partially fulfilled, or not fulfilled. And we have in Serbia this situation where funding of SOS helpline is related to some state institution, not women's organizations, but I believe that Biljana Stepanov and other participants will be able to tell more about it. So this is the briefly result, but we can go into details further. We can go to the next slide. So what we tried to see is how much money has been allocated from the states, from the government, from the state budget to SOS helplines, and how these helplines are organized. Are they organized as by or provided? Is the service provided by women's organizations or some other entity? In our cases, we also try to see are data available and transparently, easily accessible, and this is not the case. So we were using different sources of data in order to estimate available funds. And then we asked also SOS helplines about their sources of funding and their annual budget. And then we tried to estimate how much money is allocated by the state. What is also self-understandable, that we first of all did the mapping of SOS helpline services and their structure and their legal form. And then we collected some additional data that I will present further. And then we try to estimate how much money is allocated by the state. Can go further. We mapped the legal framework, SOS helplines, and the structure of the service per country. And this kind of description is provided in the paper. Then we collect data about the number of calls, number of service provider, and annual budget. We try to calculate it, how much money the service costs per women or per call, and also including sources of funding. Usually there is there is this complaint or advocacy attempt from women's organizations that they are not able to further developing the service. They are just at the bare minimum of service provision to those who are in the most need because they don't have enough money. And there is also discussion about obligation for providing money. So from Istanbul Convention, it is clear that states are expected to provide funds, but we can ask ourselves, and it can be also a question for us during the discussion, is for what do we need additional money, how much money we do need annually, and for what, and how we are going to measure this. So this kind of calculation or estimation of costs has been done by Women's Center Užice and SOS Network in Serbia, National SOS Network. We have another one represented today by Biljana Stepanov. So this is provincial SOS helpline network. But this calculation has been done at the central level. And there are some kind of costs estimated. How much money the service provision or maintenance of the service costs without any additional development or prevention or outreach. So we would like to see how we can further develop methodology also on general and specialized services, also provided or defined by Istanbul Convention. And we can, I would like to hear your suggestions on that one later. We have just a few more slides, maybe one or two. So for us to wrap up, for us it's very important, and you can see in our paper that state funds for SOS helplines are really minimal. Also, in some countries, they are regular, annually provided, usually by the Ministries of Social Affairs or gender equality mechanisms, who are in most cases providing money for lines, for phone lines, or for this kind of technical costs, but not for costs of personnel or women who are providing services, or this can be like science fiction, to have additional money for their well-being, maybe for some kind of support to service providers, or their additional learning, or their additional education. There are no funds for development of services, questions of accessibility, availability of service. But what is really important and obstacle for advocacy and for monitoring and for analysis is the lack of data from SOS helplines. Having in mind this kind of anonymity of callers or women who are called SOS helplines, usually networks are not able to provide data about number of women or data about their location, age, disability, a number of calls, are they returning or they are calling just one time? What is the impact of service provided? Like, have they been advised to call the police or to do prosecution? What is the outcome of the case particularly? So we are not sure how we can collect this kind of data and do cost-benefit analysis. And maybe you are aware of some similar exercises that can be shared with us, so we can try to do it at the regional level. So we are trying to see how we can improve performance indicators of SOS helplines in order to have stronger cases for advocacy, if it's needed. If not, it can be discussed further. And also how we can do this kind of strategic planning, what is needed for further development of the service. Okay. So I think this is the last slide. Thank you for your attention. I hope it was clear. So what we have done and what we are planning to do further, it can be complicated from methodological point of view, especially if we want to expand our analysis to the entire scope of combating gender-based violence or providing protection for women exposed to gender-based violence. But in this case, if we are talking about SOS helplines, we can always ask ministries and governments how much money they allocated, how they are funding SOS helplines. And on the other side, we can ask SOS helplines, how much money do you need? And then we can ask, okay, for what and how we can measure our results. So it is in a nutshell. Thank you. Now we have representatives of our partners from SOS Helplines. We have Moldova La Strada, organization that is providing services also for victims of human trafficking and gender-based violence, and they have SOS Helpline available 24/7. There is also Nataša Mujkanović from Fondacija Lokalne demokratije from Bosnia and Herzegovina, Jovana Spremo and Mizeta Tomljanović from Lara Foundation, also from Bosnia and Herzegovina, Stavka Todorovska from National Council for Gender Equality in North Macedonia, Biljana Stepanov from network from Serbia,
Ако јел могу Вишња нешто да каже? Вишња, јел могу нешто да каже?
Correctly. Counseling line for women and girls from Albania. Present, please. Yes? Yes.
Kad ste mene predstavili Savka Todorovska, Nacionalni savet, to je tačno organizacija, ali zato što je ovaj webinar i ovaj sastanak za SOS liniju, ja mislim da treba da stoji Nacionalni savet za rodnu jednakost, nacionalna SOS besplatna mobilna linija, SOS linija u Makedoniji, koja je jedinstvena od ovog tipa. Mislim da tako treba da bude, zbog toga što da znamo zašto pričamo. Zato što Nacionalni savet ima i drugi program i drugo, pored SOS linije. Ali sada danas pričamo samo za SOS liniju i ja mislim da tako treba da bude. SOS, linija mobilna besplatna. Eto, hvala.
Thank you for the intervention. So Daniela, welcome.
Welcome. Thank you. So I think I have some problems with translation in English, but I think we could help each other. Hello to everybody. My name is Daniela Dabija. I'm a psychologist, and I'm working in La Strada, I think, for 9 years. We in La Strada manages 3 hotlines. First of them is an online chat services for children. And the children can report any form of abuse online. There is Sigur Online Yes. Second is a hotline for human trafficking. And a third hotline is the trust line for women and girls, where I am the manager of this service. So trust line for women and girls was created in 2009 by La Strada. And this service activates non-stop and is free for everybody. Callers could remain anonymous if they wish. Phone callers can be women and men, adults or children. But everybody could report just a case of domestic violence or a case of sexual abuse. And victims that could be assisted are just women. And now they don't have some services special for men, for example, victims of domestic violence. But since 2017, Trust Line is a service of Ministry of Social Protection and Labor, but it remains to be managed by La Strada. But all the funds are from Ministry of Labor and Social Protection.
Daniela, if I can just ask you one question.
Yes.
So this is La Strada is NGO.
Yes.
We know that. And your service for SOS Helpline is funded by the state entirely. Is that right?
No. If I understand your question, so this services was created by La Strada, firstly, but now this service represents a service of the ministry.
Okay, I understand.
But it remains to be managed in La Strada.
Mică intervenție, dar este finanțată din partea statului? Is it funded by the state?
Yes.
So you have some funds from the government?
Yes, and the government funds the salary of a psychologist from the phone, all the phone bills, and managers of this service, and also all the phone bills and IT specialists who assist all the technique to function well.
Okay, thank you.
So also victims of domestic violence can report any form of domestic violence. The person can be consulted legally, psychologically, and socially, yes. And if any child is in danger, we are obliged to notify the authorities. Similarly, depending on the need of victims, she will be referred to specialized services. For example, shelters or centers of mental health or any other center, depending on her needs. At the same time, in La Strada exists a support team made up of a lawyer and a psychologist. And this support team, which consists from lawyer and psychologist, is managed and funded just by La Strada Center. And this team assists live victim of sexual violence and domestic violence. So lawyer represent the victim in the police, in the court, or other proceedings. But psychologists also could offer all the support during all the proceedings, and also to elaborate psychological evaluation reports.
Before you proceed, Savka raised her hand, so maybe there is a question for you. If you don't mind, maybe we can do it like this. Savka, please.
Super je Daniela rekla, samo meni, ja možda nisam čula koliko operatorica rade na SOS telefonu.
How many operators you have at the SOS helpline? Maybe you said it, but Savka maybe didn't hear it.
So it is important a question now. We'll answer now. So I have 4 counselor, psychologist, and 1 manager, me.
Okay, thank you.
I also have a question, quick question. How many calls do you have per week, per day?
So it's very different, but we could have, I think the most 26 calls for 1 day, yes, and the minimum is 0. But for 1 year, for example, we have 1,600 calls for year. And it depends on a part of year. For example, in the autumn, when Moldovan people like the wine, we have more calls, surely. And in the summer, for example, when we have a period for vacancies or is hot outside and they could go I don't know, to a neighbor, to the garden, we have less calls.
Less calls. Sorry, Daniela, I just realized that I forgot to mention that we have data not only for La Strada, but also for other helplines in the region and Republic of Moldova. And there is about 1,000 of calls per year. This is some kind of average. And also we calculated that service costs around between 200 and 300 euros per month. So that this is a price of service provided by psychologists or counselors. And we think that this is really a small amount of money and that different kind can be increased, that this is not sufficient. Please continue. Sorry for interrupting.
So for me, it's more difficult to estimate how much we need for 1 month because we have the fund from the government, and it's maybe not very sufficiently. That is how it is. Also, it's important to add that Trustline have some collaboration agreements with the service 112, and we have the opportunity to have some calls in conference. For example, when a victim of violence call to service 112, and they don't have so much time to talk with her. The operator of 112 add to this call a psychologist from Trustline, and in free we try to resolve this situation. Till the operator from 112 call the police or ambulance, psychologist could talk more about her safety.
Okay, thank you very much. If there is this is only introduction, we can go back to Daniela after. We have our next participants from Bosnia and Herzegovina. I think Natasha is the next. So please, Natasha, present your organization and your experiences and your perception about sufficiency of funds available for your services.
Šaljem pozdrave iz Sarajeva. Vjerujem da me čujete. Ovako, nalazim se ispred plakata našeg SOS linije, ova prva linija koja je 2004. osnovana. Inače, da se predstavim, ja sam Nataša Bacanovic, koordinatorica u Sigurnoj kući koja radi direktno sa žrtvama nasilja u porodici i ujedno radim i na SOS telefonu. Nekako smo se stopili s tim SOS telefonom koji kad uđemo na radno mjesto držimo ga čitavo vrijeme u rukama tokom svih aktivnosti koje radimo. Inače, Fondacija lokalne demokratije vodi jedinu sigurnu kuću u kantonu Sarajevo, znači organizacija koja vodi sigurnu kuću i SOS telefon. Također, ono što je jako bitno da smo mi upravo kroz rad na SOS telefonu i direktno sa žrtvama nasilja u porodici kreirali i dodatne servise pomoći. Imamo jedan centar za žene koji je na odvojenoj lokaciji. Uvijek kažemo, imamo nekako mi neki svoj unutarnji sistem koji smo razvijali. Tako da imamo i besplatno pružanje pravne pomoći kako žrtvama nasilja koji su smješteni u sigurnoj kući, tako one koji nisu u sigurnoj kući, i imamo psihološku podršku također korisnica koji su kod nas na smještaju gdje imamo psihologinju, ali one koje nisu korisnice u sigurnoj kući mogu dobiti besplatno, znači govorimo o besplatnim aktivnostima pravne pomoći, besplatno psihološko savjetovanje i ekonomska podrška. Što se tiče SOS telefona, on je počeo sa radom 2004. godine uz pomoć tada vlade Kanade, koja je bila uključena u cijeli proces. Tu je bila jedna 6-mjesečna obuka za uposlene u sigurnoj kući i za volonterke koje su radile sa fakulteta političkih nauka. Tako da je to možda otprilike da s nekih godinu dana su bile uključene ove volonterke. Međutim, kako su završavale fakultete, one su odlazile, tako da je u stvari čitav taj posao prešao dodatno na nas uposleni, tako da mi nemamo kao uposlenici, nemamo neka dodatna finansiranja. I SOS linija koja je bila ta 0332222000 smo u stvari, organizacija je finansirala i dalje tek 2008. godine Gender Centar Federacije pokreće 4-cifreni broj 1265 i Gender Republike Srpske 1264 gdje smo se mi priključili tom sad broju koji je u suštini besplatan za korisnike i on funkcioniše po principu, recimo, kad neko zove iz kantona Sarajevo ili Bosansko-Podrinjski kanton, možda je malo sad teže za ljude koji baš naš malo sistem kako funkcionišu, onda kad zovu na 1265, onda se mi javljamo tim pozivima, a recimo, ne znam, ako je neko iz drugog kantona, onda ima, znači to je sad neki sistem koji je jednačen, ali isto tako mi smo nekako, ja bih rekla, još uvijek vezani za ovaj naš početni 2004. On je pridružen i ovom SOS telefonu, ali nas mogu ljudi dobiti na ovaj 3 dvojke, 3 nule koji je jako prepoznatljiv telefon. I mislim, ono što je možda također jako bitno, da smo mi 2004. već potpisali protokole saradnje, jer nam je generalno bilo važno kao organizaciji da se otvorimo prema institucijama kako bi sve žrtve nasilja bile evidentirane u sistemu. podrške, tako da je SOS telefon, on je aktivan 24 sata u koje god bilo doba dana, noći da neko pozove, naravno ćemo se javiti na telefon, i on je prvobitno imao tu onu urgenciju u smislu da kada neko pozove i traži pomoć, da mi možemo uputiti policiju na adresu, gdje imamo onda i dežurnog socijalnog radnika koji je na kantonu Sarajevo, gdje nije slučaj na cijelom području Bosne i Hercegovine, gdje se isto tako aktivira da se vidi kolika je u stvari potreba, da li će se žena sa djecom biti smještena u sigurnu kuću, i tako i radimo po principu su 4 koordinatorice koji se mijenjamo 24-satno dežure, tako da se smještaj u sigurnu kuću može realizovati i tokom dana i tokom noći. Mislim da je to onako nešto također jako bitno, tako da što se tiče, znači mi imamo taj 1265, to finansira Gender Centar, to je neka tehnička podrška, ali nekakvih dodatnih sredstava mi nemamo. Mi sad imamo negdje u planu možda da se ponovo aktivira, da se mogućnost da se još dodatnih volontera koji bi se obučili za rad na SOS telefonu, zato što je dinamika nekad, jer kažem vam, mi radimo direktno i sa žrtvama nasilja, imamo žene, imamo djecu, nekad smo, recimo kapacitet nam je 35, nekad bilo je 40, smo imali preko kapaciteta ili više, gdje onda radimo znači na SOS telefonu, i mi isto tako bilježimo da smo na dnevnom nivou nekad 4 poziva, nekad 6, znači na godišnji, u stvari mjesečnom nivou imamo preko 100 poziva. Od 2004. na ovamo smo već nekih 16.000 poziva imamo, tako da je ono možda što je interesantno da mi imamo obrazac koji smo kreirali, gdje može se prijaviti znači nasilje u porodici, ako je u pitanju neko drugo nasilje, uznemiravanje od, ne znam, komšija ili partnera koji nisu u bračnoj zajednici ili vanbračnoj. Također imamo tu psihološku podršku, upućujemo na neke pravne savjete, tako da mislim mi zapisujemo to. I ono što je također važno, što mi generalno radimo, jeste ako neko sa strane, u stvari promocija čitavog SOS telefona jeste i cilj da se javnost informiše, da i građani mogu prijavljivati nasilje, da ne moraju pozivati policiju, jer nekad jednostavno nemaju povjerenja ili misle da će na neki način njihov identitet biti otkriven, tako da mogu pozvati SOS telefon gdje mi onda upućujemo policiju. Ili ako žrtva sama ne želi da prijavi, ili pogotovo kada se radi o djecu i maloljetnim osobama, gdje mi popunjavamo SOS formular i upućujemo na centre za socijalni rad koji imaju ingerencije da mogu, ne znam, posjetiti, otići u tu porodicu i informisati se šta se u stvari tu dešava. Mislim da je to onako jako pozitivno. Tako da je nešto, mislim da najviše u stvari ne smijemo zanemariti period korone, gdje je SOS telefon bio ključan u tim situacijama tog psihološkog savjetovanja. SOS telefon, on prelazi te granice, ne samo te urgencije. Toliko osoba imaju napravi prvi korak, da uopšte počnu govoriti. Nekad govori u trećim licima, da se to, u stvari se to dešava njima, gdje će ih neko saslušati, gdje će ih uputiti, gdje mi nekad smo toliko na telefonu, baš nedavno možda primjer jedan SOS-a gdje sam bila uključena, gdje me zove čovjek koji želi da pomogne sestri, jer se dešavala, bila je situacija nasilja, oni su uspjeli da joj pomogne iz kuće i koji sad traži pomoć, šta on konkretno može uraditi, gdje onda mi dajemo jasno upute. Tad nije bilo iz Sarajeva poziv, bio iz drugog kantona, tako da je nekad dobar taj 222 000, jer ne bi mogao na 1265 da nas dobije. Tako da smo onda jasno, smo onda vrlo striktni i nekako dajemo tu motivaciju ljudima da trebaju prijaviti nasilje, šta mogu uraditi, koja su njihova prava, šta mogu tražiti, jer mi imamo izricanje i zaštitnih mjera, tada su djeca bila ostala u kući, tako da je, mislim, to je jako bitno da ljudi imaju tu nekakvu podršku i da mogu u tom trenucima dobiti također one jasne informacije šta je sa SOS telefonu. Tako da mislim da nam je promocija bitna, afirmisanje SOS telefona. Mislim, meni je jako bilo interesantno uopšte ova tema, više smo zanemarili da bi se uopšte moglo nešto pričati na ovo važnost finansiranja. Iskreno, mi smo se toliko stopili s tim i toliko radimo da mi ni ne razmišljamo mi na tom ličnom nivou. Mislim, ja sam od 2005. u fondaciji, tako da nije u sigurnoj kući da je to nešto dio vas, ali u stvari naravno da vam je potrebna, mislim, podrška toliko toga i mislim da i crpi, mislim, imate tu ljude koji vas pozivaju, naše bivše korisnice koji pozivaju na SOS telefon, jer su emotivno vezani dalje, nekako da imaju potrebu, ako su nekakvoj nedoumici i ponovo imaju određene probleme, podrške, tako da je to nešto vrlo interesantno koliko je neophodnost. Ali kažem vam, mi finansiranje nemamo u tom smislu da mi imamo podršku, ok, mi imamo tu tehničke stvari, mislim da je to u stvari ključni nosioci smo mi tog SOS telefona, da pružamo podršku i u stvari nekad nismo ni svjesni koliko smo i mi izloženi, jer ljudi nas nekad u medijima gledaju, mi smo ti koji se javljamo, koji pružamo te savjete, ali mislim da je bitno da imamo ove potpisane protokole o saradnji sa centrima za socijalni rad i policijom i gdje možemo onako da budemo motivirajući, da stvarno prijavljuje se nasilje i da pomognemo ženama i da one mogu biti onog momenta kad pozovu na SOS telefon da mogu dobiti smještaj u sigurnoj kući. Sad ne znam ako ima nekih pitanja, ja mislim da sam rekla osnovno, tako da...
Hvala mnogo, Nataša. I don't know. Okay. Here I am now in this main audio channel. Natasha, thank you very much. I'm not sure who is our next speaker. Jovana from Fondacija Lara, is that right? Or we have additional maybe questions before we start further, before we continue. Maybe you have some questions or comments on what Natasha presented.
Hello. Yeah. Hello. Good afternoon, and thank you very much for the invitation and for possibility to be, let's say, with you today. I'm representing Albanian Center for Population Development, and we are also working with EADC for a project on supporting also the emergency, let's say, situations in the north of the country, and how we can also do gender budgeting to respond to this crisis. Do I have time to, if we can explain something regarding services, or shall I do it later on?
I think it would be better if you can do it later, because we have speakers and this agenda to follow. So when we will have a time for discussion, and thank you for being with us.
Okay, thank you. Thank you.
Jovana, please proceed. Jovana and Mirzeta.
Dobar dan. Mi smo napravili prezentaciju, ja sad ne znam da li vi možete to podijeliti na ekranu ili... Mislim, možemo i bez prezentacije.
Okay, here it is.
Ja sam Jovana Spremao, koordinatorica Sigurne kuće Fondacije Lara. Sa mnom je Mirzeta Tomljanović, ona je tehnička koordinatorica Sigurne kuće. Fondacija Lara vodi servis SOS telefona za prijavu nasilja. Može se i prebaciti sa slajda ovako. SOS linija 1264 je dostupna 24 sata svakoga dana u godini. Poziv na ovu liniju je besplatan i povjerljiv odnos između sagovornika. Također ovaj poziv može biti anoniman ukoliko osoba koja poziva to želi. Na SOS liniji rade obučene savjetnice za rad koje su prošle edukacije i obuke kako bi mogle raditi na ovoj liniji. Može i sljedeći slajd. SOS linija za pomoć žrtvama nasilja je uspostavljena na entitetskom nivou, što znači da postoji na nivou Federaciji Bosni i Hercegovini linija 1265, a na nivou Republike Srpske jeste broj 1264. Na području Republike Srpske na inicijativu Gender Centar Republike Srpske 2005. godine uspostavljen je jedinstveni kratki broj 1264. SOS telefon vodi specijalizovane nevladine organizacije za pomoć ženama žrtvama nasilja. Može sljedeći slajd. SOS linija je uspostavljena kako bi žene mogle dobiti senzibilisan savjet i podršku. Pozivom na broj 1264 žrtve nasilja u porodici ili drugih oblika rodno zasnovanog nasilja mogu dobiti psihološku podršku, informacije o zaštiti svojih prava, kao i procedurama zaštite prava pred različitim institucijama. Može dalje. Što se tiče finansiranja SOS linije, dakle nisu predviđena nikakva sredstva iz budžeta Republike, nego je to prepušteno organizacijama koje vode ove servise, dakle tu je volonterski rad, nisu predviđena nikakva sredstva za rad operatirke u stvari koje radi na ovom servisu. Fondacija Lara je ove godine uspostavila i bazu podataka. Ova baza namijenjena je za unos, vođenje evidencije i pregled informacija o pruženim uslugama. Tu se između ostalog nalaze dakle i usluge SOS telefona gdje imamo pregled podataka o ženama koji su pozivale na ovaj broj, nekim osnovnim podacima o njima. Naravno, ovdje je ostavljena mogućnost anonimnog poziva, dakle ukoliko žena ne želi da da bilo kakve podatke, ne moraju se ti podaci unositi, dakle baza podataka priznaje i to polje anonimnog poziva. Može sljedeći slajd, ja sam zaboravila da kažem. Također i mi, to je spomenula predstavnica Fondacije lokalne demokratije, isto imamo obrazac, to je upitnik za osobe koje pozivaju na SOS telefon, gdje se unose osnovni podaci o osobi koja poziva, socijalna karta, tu su neki podaci o žrtvi nasilja i o počiniocu nasilja. To je bilo na sljedećem slajdu. Datum obraćanja, da li osoba poziva prvi put ili je tu ponovljeni poziv više puta, problem zbog kog se obraća, ono što je urađeno, da li je upućena na neku instituciju i slično. Što se tiče u prvih 10 mjeseci ove godine imali smo 658 poziva i tu je primjetan neki porast u odnosu na prethodni period. Ne znam, da nešto je dostavljeno, što je to? To je ukratko, jeste. Ne znam da li to treba odgovoriti. Ukoliko imate neka pitanja da nešto nismo rekli ili je bilo nejasno, što se pored drugi slajd.
Okay, thank you very much. Is it end? Thank you. So maybe if there are some questions, you are more than welcome to ask, or we can proceed with our next speaker, and then we'll have time for discussion.
Am I next?
Sorry?
Am I next?
Yes, you can be next.
Okay.
You
Sorry,
and...
but
yes.
So is someone else before me?
No, I think no.
Okay.
You and then from Albania, we have an additional speaker, Biljana Stepanov, president of the board of SOS Helpline from Vojvodina, Serbia. Biba, please.
Thank you
we
for...
also have Savka to present, or somebody from their organization from Macedonia.
Okay.
Okay,
yes.
so just you proceed. I will wait.
Ne, vidi, ja prvo tebi hvala što si se prijavila da nam pomogneš, osobito evo meni lično, a moja koleginica, pravnica iz Savjetovalište za žene žrtve porodičnog i rodovo baziranog nasilja, će da govori engleski, a pitanja, i ja sam tu zbog onoga što će trebati da kažemo. Inače, tebi hvala. Ja samo prije da počne moja koleginica, ja hoću da pokažem, ovo je Labina koja je glumila pred kiše, ako se sećate, Milča Mančevski, a u stvari ona je naše zaštitno lice i evo tu su brojevi našeg telefona, SOS mobilnog telefona i evo sada će moja koleginica da produži, a vas sve pozdravljam, a posle u diskusiji ja ću da se uključim i da pitam ono što u stvari sam htela da pitam naše drugarice koje su govorili do sada.
Hello, everyone. My name is Ružita Pinzovska. I'm a legal advisor in the Counseling Center for the Gender Equality. The team of the Counseling Center is also with two more members, as a psychologist and a social worker. Furthermore, I would like to present the sorry.
I ne brzaj tu.
Neke.
Moram da te privedu.
Yes, you can proceed.
Okay. So furthermore, I would like to present our organization and the SOS line. So within the Union National Council for Gender Equality Framework, the 24/7 free mobile SOS line, 141700, operates proficiently in 4 languages: Macedonian, Albanian, Roma, and Turkish, with a dedicated team of 6 operators. The network is committed to representing the interest of victims and ensuring swift and appropriate resolutions for those seeking to escape violent environments. The invaluable support of local mobile operators has facilitated the line's crucial mission. Since 2018, the Ministry of Labor and Social Policy has recognized the imperative nature of the service, backing it after the ratification of the Istanbul Convention. In the previous 10 years, the SOS line has been provided assistance free of charge, thanks to the volunteer efforts of 2 dedicated operators, Savka and Svetlana. The inception of the helpline dates back to 1994, inspired by similar initiatives in European countries, marketing the establishment of the first helpline for women victims of domestic violence in Skopje. The project received vital support from the Dutch Inter-Church Organization, contributing 10,000 marks for its creation, and an additional 10,000 marks were distributed for the purchase of establishment of the first shelter. Remarkably, this initial shelter, still operational today, operates under the auspices of the Women Organization of the City of Skopje, with network members actively involved in the establishment and provision of the space. In conclusion, our unwavering commitment to this cause is fueled by a profound sense of care and love for women who have endured the harrowing experiences of family and gender-based violence. Over the past 3 decades, we have tirelessly championed the establishment and continuous empowerment of the dedicated SOS line. As we move forward, our dedication remains resolute, propelled by the firm belief that every woman deserves a permanent and efficient lifeline in their moments of crisis. Together, let us persist in our collective efforts to create a safer and more supportive future for all. I would also like to add that the financial support from the Ministry of Labor and Social Policy is actually is measured by the according to the number of human resources and overhead costs for the SOS line in order to ensure a functional and accessible line 24/7. Thank you.
Thank you very much. So for now, we learned that almost all SOS helplines have been founded by women's organizations. And then in order to ensure or to enable sustainability, it was transferred to be funded by the ministries. Is it the case in Serbia as well? Biljana, please do proceed, and then we will have additional discussion. Thank you.
Okay, thank you, Visnja. Thank you for invitation. I will follow in Serbian, if you don't mind. Znači, SOS Vojvodina Network ili mreža SOS Vojvodina postoji već 11 godina. Pre toga ženske nevladine organizacije koje čine mrežu postoje više od 20 godina i mrežu su osnovano je 5 ženskih nevladinih organizacija koje rade na teritoriji Vojvodine. Znači, formalno mreža postoji mnogo ranije, ali smo formalno registrovani, da tako kažemo, kao mreža i postali smo pravno lice 2012. godine. Mreža funkcioniše kao licencirana usluga socijalne zaštite, licencirani smo od strane Ministarstva za rad, zapošljavanje, boračka i socijalna pitanja. Licencu imamo od 2016. godine, isteklo je prvih 5 godina licencirane usluge i sada smo dobili produžetak licence, u stvari dobili smo tu takozvanu trajnu licencu. Ono što je, ako možemo tako da kažemo, karakteristično, to je da smo mi napravili jedan broj telefona koji je praktično rutiran i po određenom rasporedu i po tom principu, ako tako možemo da kažemo, zauzetosti. Pozivi se rutiraju iz onog mesta odakle žena poziva, rutirani su u najbliži SOS centar. Tako da mi praktično pokrivamo, da kažemo, celu Vojvodinu, međutim, to nije tačno, jer mi pokrivamo i celu Srbiju. Imamo pozive i sa Kosova i tako dalje. Znači, sa cele teritorije Srbije žene nas zovu iz jednog prostog razloga, zato što je naš besplatni broj 0800 10 10 10 dostupan svima. Bilo ko iz bilo koje fiksne telefonije, iz bilo koje mobilne telefonije, ako pozove 0800, taj poziv će biti besplatan i bit će usmeren ka jednoj od najbližih SOS organizacija. Ono što je važno da se zna, znači da smo mi još 2016. godine, znači kada smo prvi put licencirani, mi smo izradili jedan model, praktično izradili smo cenu, utvrdili smo metodologiju po kojoj se utvrđuje cena koštanja jednog poziva, u stvari usluge. Tako da tu je bilo puno nedoumica u Srbiji šta bi u stvari trebalo da se finansira i kako bi trebalo da se finansira, pa su neki zagovarali da treba finansirati po broju poziva, pa da treba finansirati po broju žena, pa da treba finansirati po broju usluga koje je ženama pružena i tako dalje, da ne može da bude jedna cena, ne znam, za javljanje na SOS telefon, a da je druga cena, znači da mora biti druga cena za psihosocijalnu uslugu, da mora opet biti različita cena za pravno savjetovanje, informisanje i tako dalje. Tako da je taj proces u Srbiji bio dosta izazovan. Ja moram da kažem da smo mi sve pripremili za mrežu SOS Vojvodina i naša mreža se finansira praktično po standardima i principima rada i internim dokumentima koje smo mi izradili za nas u skladu sa našim potrebama i u skladu sa onim kakva je situacija kod nas. Ne možemo da kažemo da je ista situacija u centralnoj i južnoj Srbiji. Postoje ženske nevladine organizacije koje takođe pružaju usluge SOS telefona, ali nisu umrežene ovako kao mi i to je jedna stvar. I druga stvar je neke od tih organizacija nemaju stalno zaposlene osobe. Ono što je karakteristika mreže SOS Vojvodina je da kod nas rade isključivo stalno zaposlene osobe. Nemamo volontera, znači radimo kao profesionalna usluga. I ono što je takođe za nas negde važno, vidim da su i druge koleginice navodile, ja mogu da kažem da mi na godišnjem nivou imamo više od 15.000 usluga, da je, recimo, možemo da kažem, za 10 meseci ove godine imali smo 1307 SOS poziva, od toga 763 su bili samo pozivi, znači bez drugih usluga, Sve ostalo su bile druge vrste usluga koje su pružene ženama, znači u zavisnosti od toga šta je ona svedočila i koju vrstu pomoći i podrške je tražila. Mislim, ono što je kod nas karakteristično, ako tako mogu da kažem, to je da mi u skladu sa našim zakonom o socijalnoj zaštiti nijedna ženska nevladina organizacija ne može da pruža usluge maloletnim licima, znači ne možemo da pružamo usluge deci. Tako da u slučajevima da su deca žrtve nasilja, mi radimo sa roditeljima, znači radimo sa majkama sa jedne strane, sa druge strane tražimo najbolja alternativna rešenja gde se radi sa detetom i tako dalje. Mi smo ove godine akreditovali prvi put u Srbiji, akreditovana obuka za vođenje forenzičkih intervjua za decu koji su žrtve seksualnog nasilja. Ovo je jedina takva obuka na celoj teritoriji Srbije i mogu da vam kažem da je interesovanje ogromno. Naše koleginice putuju po celoj Srbiji i drže ove obuke i za centre za socijalni rad i za sve druge pružaoce usluga socijalne zaštite. Ono što je takođe važno, to je da se mreža SOS Vojvodina od samog svog početka finansira isključivo donatorskim sredstvima. Vi znate za čuveni primer, znači to jeste bila negde predominantna ideja da svaka država u regionu, pa samim tim i Srbija, da napravi jedan jedinstveni call centar, ako tako možemo da kažemo, u stvari jedinstvenu SOS uslugu kao nacionalni SOS koji bi trebao da pruža tu uslugu jedinstveno za sve žene na teritoriji Srbije. Država Srbija je to uradila, ali potpuno ignorišući sva postignuća, iskustvo i znanje ženskim organizacijama koje, kao što sam rekla, ne samo moja organizacija, nego većina ovih organizacija u Srbiji radi više od 20 godina. Znači, država Srbija ima nacionalni SOS telefon koji vodi organizacija koja je nikla ni od čega. Mi i dan danas, posle godina i godina funkcionisanja tog telefona, mi ne znamo ko radi na tom telefonu, mi ne znamo koje su specijalizacije tih žena i tako dalje, a država Srbija na godišnjem nivou odvaja 30 miliona dinara za finansiranje ovog telefona. Znači, ogromna sredstva se izdvajaju da se pritom, znači njihovi izveštaji su vrlo šturi, ne rade po feminističkim principima i tako dalje. Znači potpuno jedan suprotan model od ovoga što rade ženske nevladine organizacije. Finansiranje ženskih nevladinih organizacija u Srbiji je vrlo sporadično, vrlo individualno i vrlo skromno. Znači, one organizacije koje se finansiraju dobijaju sredstva na lokalnom nivou i to samo isključujući ako izvrše dodatni pritisak na lokalne samouprave, pa da se tu odvoje neka sredstva, ali opet kažem, znači to su vrlo, vrlo skromna sredstva koja nisu dovoljna čak ni za angažovanje jedne, dve ili tri stalne saradnice na SOS telefon. U našoj mreži, kažem, situacija je drugačija iz jednog prostog razloga što mi uspevamo još uvek da nađemo donatorska sredstva iz kojih finansiramo usluge. I ono što je za nas takođe bilo izuzetno važno, mi smo pre par godina napravili integrisani informacioni sistem. To je jedna, da kažemo, jedna baza podataka koja je instalirana u svakoj od naših organizacija. I ta baza nama praktično pomaže da mi u svakom trenutku znamo koliko usluga, kojih usluga, da uradimo procene rizika elektronski, sve nam pomaže da radimo u njoj. Mi u svakom trenutku kad nam neko zatraži neke podatke, mi možemo samo jednim klikom da dobijemo tačno koliko je ko, gde, kad i kako pružio kojih vrsta usluga. Ja odmah moram da kažem da je kod nas najveća dilema u finansiranju usluga bila upravo u tome koje usluge su sada tu prioritetne, znači da li svaka usluga ima istu težinu, po znacima navoda. Znači, naravno, mi nismo razmišljale na taj način. Za nas su sve usluge jednake, sve žene koje su stručne i koje su angažovane na pružanju usluga, one imaju adekvatnu finansijsku nadoknadu. Znači, za nas uopšte nije bitno da li je neka konsultantkinja imala 1 ili 10 usluga. Ako mi postojimo, pa barem i da jednoj ženi pomognemo, naša misija je, kako da vam kažem, uspela. Tako da, mislim, mi dalje, kažem, funkcionišemo, rekla sam, donatorskim sredstvima. Ono što je za nas takođe jako važno, imali smo mogućnost da opet putem donatorskih sredstava izradimo mobilnu SOS aplikaciju za prijavu nasilja. To je aplikacija, zašto je ona važna? Zato što je to samo još jedan kanal komunikacije sa ženama koji pozivaju SOS. Znači, ovo jeste, evo vidite, sad ne znam koliko se vidi, evo ga, ovako ću malo dokrenuti, SOS Panic Taster, znači mobilna aplikacija, žena ne mora ništa da uradi, dovoljno je samo da drži prst na telefonu 5 sekundi i apsolutno će najbliži SOS centar će dobiti poruku da je žena u opasnosti. Ono što je za nas jako važno, to je da mi u našoj mreži imamo organizacije koje rade sa ženama sa invaliditetom, i to znači onima koje su u mogućnosti da pozovu SOS, one koje nisu, znači one koje su žene sa problemima vida i sluha, je upravo namenjena ova aplikacija. Znači ona je potpuno kompatibilna sa svim programima za čitanje i za govor osobama koji imaju na mobilnim telefonima osobe sa invaliditetom. I takođe u našoj mreži funkcionišu i ženske organizacije koje rade sa ženama Romkinjama. Jedan od važnih elemenata ove aplikacije je to što je ona dostupna na srpskom, engleskom i na romskom jeziku. Znači, ovo je prva, da kažemo, autentična aplikacija dostupna ženama na romskom jeziku, na tom takozvanom, da kažemo, opštem dijalektu romskom, zato što znamo da postoji nekoliko dijalekata u Srbiji, tako da smo mi uradili to na tom, tako da i žene sada iz romske populacije mogu na svom maternjem jeziku da pozivaju SOS telefon. Ovo je takođe besplatna mobilna aplikacija, mi imamo sporazume sa mobilnim operaterima koji omogućavaju da je ova SOS linija takođe besplatna za sve žene. Znači, uopšte nije bitno da li imaju kredite na telefonu, da li imaju interneta ili šta god. Ako pozovu, znači ako instaliraju i ako pokušaju da prijave, oni će moći da prijave. Ono što takođe smatram izuzetno važnim i možda bi negde moglo da se razgovara, a to je, barem kad je Srbija u pitanju, to su izazovi rodno odgovornog budžetiranja, gde prvo sa jedne strane vi imate ženske organizacije koje nemaju puno ili, ako možemo da kažemo, nemaju dovoljno znanja vezanog za finansiranje kroz mehanizme rodno odgovornog budžetiranja, znači nisu upoznate sa programskim budžetima, nisu upoznate sa programskim aktivnostima, ne znaju, one u stvari ne znaju šta piše u budžetima lokalnih samouprava kada se ti budžeti pripremaju i kada se posle usvoje. Znači oni ne znaju da negde pronađu gde su te pare eventualno u budžetu koje su namenjene za rad SOS telefona. Vrlo često to finansiranje ide kroz finansiranje koje je namenjeno svim organizacijama civilnog društva. Znači jednostavno te specijalizovane ženske organizacije se stavljaju u isti koš zajedno sa svim drugim organizacijama civilnog društva i naravno tu je malo para, puno je organizacija i onda se negde, ako tako mogu da kažem, ignorišu potrebe ženskih specijalističkih organizacija ili im se izlazi u susret sa minimalnim sredstvima. Sa druge strane, postoji potpuno nerazumevanje i postoji negde, ako možemo tako da kažemo, i blagi otpor lokalnih samouprava da se finansiraju usluge ženskih nevladinih organizacija. Međutim, ja moram da kažem da je moj neki preovlađujući stav da u Srbiji generalno ima jako malo para za socijalne usluge i mislim da je negde ta sudbina koja je snašla ženske nevladine organizacije kad je finansiranje u pitanju, tu sudbinu dele i usluge socijalne zaštite, prvenstveno centri za socijalni rad koji imaju sve manje kapaciteta, ljudi odlaze, nema dovoljno stručnih kadrova, nema tog nekog, kako bi rekli, institucionalnog znanja koje bi moglo adekvatno da vrednuje sve ono što se radi naravno i u organizacijama civilnog društva. Eto, toliko od mene. Izvinjavam se ako sam odužila.
Ne, hvala mnogo, Biba, jer se čujemo, vidimo. Thank you very much. So a few very interesting and important topics you raised. First of all, in general, investments in social services is also a matter of gender-responsive budgeting. Until we do not have increased funds for social services and care in general, we cannot talk about gender-responsive budgeting. And also funding of women's organizations. Thank you for sharing very interesting examples about training and about application. It is really interesting. I would like us to talk a little bit more about what are priorities for funding further when it comes to combating gender-based violence. But before that, we have another speaker. Last but not the least, from Albania. Please proceed with your presentation. Thank you.
Thank you very much. And I'm very pleased to be in this forum today. Do you hear me? Yes?
Yes, we hear you very well.
Okay. So as I said, I am a director of Albanian Center for Population Development. It's an organization that has been established since 1996 in Albania and is the largest one in terms of sexual reproductive health rights. With services that are offering a range of activities and also the clinics which are owned by the organization. So we own the office as the headquarters, and we have also the clinic, youth clinic, and clinic for women and youth and girls in Tirana, in the capital, in north, in Shkodra, and in south in Vlora. We have also established also very good collaboration with local government. In Vlora, for example, the clinic is let's say property of the local government. So we have this establishment with the local government since 1998. And the center called Aulona is quite known in the city, and a lot of women and girls are coming for a range of services, which comes from the reproductive health services, by the gender, let's say, sexual violence, by the other, let's say, social services as well for the victims of trafficking as well. So we have a really, let's say, quite a good, let's say, wide range of services. We also do have a certain, let's say, how to say, an automated, let's say, register that also can register all the, let's say, services, and we can compare also the services offered year by year. We have also recently we have also the new we have been licensed by the Ministry of Justice for offering, let's say, services for the legal aid services for vulnerable groups, and we are working also with women in the rural areas and women which are, let's say, the low economic level, how they can also profit from these free legal services offered by the government, and also helping them.
Elona,
yes.
I'm really sorry for interrupting you one more time.
Yes.
But we have announced Miss Peppa from Albania in our agenda. So I would like, if you don't mind, just you can wrap up and then we can proceed to her presentation and get back to you to share your experience.
Yeah, also I do apologize because I'm going from one meeting to the other one, and today I'm accessing this through my phone, and the battery is also going a bit running, let's say,
we are very
low.
happy to have you with us.
Okay,
Of
so
course,
thank you again. Yeah, we have a very good collaboration with ADC Center and with Mirela, and also we are also part of the project supported by them and by the regional, let's say, office in terms of the gender responsive budget with the focus on emergencies. And I'm very happy to hear all of you, this let's say inspiring women, what you are doing in service of women and against domestic violence. Apologize for taking your time.
No, thank you very much for being with us.
Thank you.
Miss Peppa, please proceed with your presentation finally.
Thank you. Hello, everyone. It's really a pleasure to be here. So I am Ange Peppa. I am the program coordinator of the counseling line for women and girls, and therefore the national helpline for victims of abuse in Albania. Actually, the organization, the counseling line, was established since 1996, so very shortly after the fall of communism in the country. And it was established by a group of prominent women and activists at the time, because a survey was conducted which found that more than 80% of women and girls in Albania had suffered at some point some type of violence. So it was identified as an emergent need to have a center that offered counseling and support to women and girls. So for more than 27 years now, we have a helpline for victims of abuse, and the helpline has a national coverage, so anyone can call from all over the country. In the beginning, the center only offered psychosocial counseling and some health counseling for victims of abuse. And now we have sort of evolved into a lifeline for victims of gender-based violence, because we offer psychological counseling, legal counseling, representation in court, referral to other services, healthcare counseling, and also we offer a range of trainings and workshops and mediation, employment mediation for women and girls. So we had been operating this helpline as an organization, as an NGO, since 1996. But in 2013, Albania ratified the Istanbul Convention, which, as it was mentioned in the presentation in the beginning, obliges all states to sort of set up a national helpline. And it took 3 years, and then in 2016, us as a helpline signed an agreement with the Ministry of Health and Social Protection, which is the institution that is responsible for all matters of gender-based violence and gender equality in the country, which gave us the status of a national helpline and gave us a 6-digit number that is free toll and free of charge, and anyone in the country could call at any time, which is 116-117. Nevertheless, even though we received this status from the Ministry of Health and Social Protection, this did not come with a financial commitment from the government. And it took a lot of lobbying and advocacy for us. And 3 years after, in 2019, we finally received 10% of the total operating cost of the helpline were covered by the ministry, by the government. And this was done through a social fund. The social fund up until then, mainly the social fund that is governmental, mainly covered shelters for victims of abuse, and maybe some trafficking shelters as well. And then it included helplines. So it started funding us and also funding another helpline that we have, not us, but another organization operates, that is for children that are victims of abuse. Now that we are speaking in nearly 2024, the government covers up to 30% of the national helpline sort of costs. What they cover is only the cost for staff, for a limited number of staff, because we have more staff to operate the helpline for 24 hours. They only cover 30%, and then the other percentage we have to raise funds for. And that is, as you might know as well, very challenging because it is project-based. And it has happened throughout the years many times. It's been the case that the counselors here have had to work on a voluntary basis in order to cover for the service to be 24/7, because that is very challenging. And sometimes you have international donors who give you a project for services, and then they can just stop the project, as it can happen to anyone. And also, maybe this is a trend that many of the other helplines might have noticed, but usually international donors now are trying to retract from giving and funding direct services, because obviously this is a responsibility of the state, and they're more into funding capacity building or awareness raising. So it's always challenging to raise funds for the helpline. During the COVID period, what happened is that our calls nearly tripled, and that is also maybe one of the reasons why we received an increase in the state funding for the helpline. Our calls tripled because first, the perpetrators and the victims were living under the same roof, and a lot of conflict ensued there. And also because many of the physical services were closed, and we were one of the few sort of services that remained open and remained at the service of the victims and all other marginalized women 24/7, even during this time. Ever since then, if before the COVID pandemic, we had around 1,000 to 2,000 calls per year. In the COVID in 2020 and 2021, we even reached 6,000 calls per year, and now we have gone to almost 4,000. So for 2023, what our data shows is that we have until now 3,800 calls for women and girls that are victims of abuse. It is not only victims of abuse that call, it could be their close ones, it could be a family member, it could be just a person who wants to report a case of violence. Not only report, but maybe seek help. All calls that come to the National Helpline are confidential. This is also a challenge that we have had when we have had to report to our donors or even to the government, because many donors now, or many sort of monitoring bodies, want you to show sort of a proof of the callers, and the phone calls are not enough sometimes, and they want maybe an ID card or some sort of other identification information for the victims. This is very challenging as well to be obtained, and we try to not ask the victims who call us for this. We only get this information if they give it to us voluntarily, because we don't want to sort of push them back and to get them scared so that they don't call anymore. So anyone can call at the helpline. At the same time, calling the helpline does not mean that you go to the police straight away. We do not have to report the police unless the victim or the survivor wants us to. So this is something that we take very close to heart, because we want to sort of empower the victims and empower the survivors to make that reporting to the police themselves, and not push them into doing something that they don't want to do. Aside all the counseling, the legal counseling and the psychosocial counseling that we offer through the helpline 24/7, we also invite some of the victims and their family members or children into the center, if it's possible for the victims to come here, and if it is needed through a risk assessment tool that one of the counselors fills out, you assess whether they should come to the center or not. And if they decide to come to the center, then we give a range of face-to-face sessions and services, which is, again, psychological service and CBT to recover from trauma. We do empowerment meetings. We do representations in court and legal counseling for issues of protection orders, for issues of divorce, alimony, and stuff like that. And also referrals to other services, as I said. Another communication channel that we have tried to introduce in the past years is online counseling. We noticed that especially the newer generation tends to be more comfortable by texting, for example. So we now have a set of mobile phones that are dedicated for platforms such as WhatsApp, Skype, Viber, Facebook chat and Messenger, and we offer counseling through these means as well. This was an innovative thing that happened during COVID, because during the quarantine period, for example, not many women could leave their houses and come to our center, and then we continued to develop it. This is also something that is not covered by the state. This is something that we raise funds for by ourselves. Another thing that we have tried to do in order to increase the service of the counseling that we offer here is that we have offered continuous trainings to our counselors, which are psychologists, social workers, psychiatrists, and lawyers. We offer continuous counseling for all types of violence, for sexual violence, for offering counseling to Roma women, for offering counseling to women with disabilities, and also for cybersecurity, which is a very important topic that I think all of the helplines should address as well, and all of the support services for victims of abuse. Because in the moment that we offer online counseling or counseling through digital means, we should also address the other part of the coin, the other side of the coin, which is basically that the internet is not always a safe place for women and for victims, and they should be taught in a way to navigate the internet in a safe way and to use digital and technology-related equipment in a secure way, because they can be used by the perpetrator in many occasions to control the victims and such. At the same time, the National Helpline is also a member of the National Referral Mechanism System in the country, which is the system that is locally based, is based in each municipality, it's managed and monitored by the Ministry of Health and Social Protection again. And it is a mechanism that manages and refers all cases of violence that happen in a certain municipality. We have established this mechanism in many parts of the country, in many municipalities of the country, and we are also members of this mechanism. So we are a focal point at the moment that a victim decides to report something or they decide to seek help. And then we refer them to either the municipality, to the police, to the shelters, in any place that they need. There are many costs that are not covered by the state for the moment. As I said, the state now only covers a salary for a number of salary and fringe benefits for a number of staff. But they do not cover, for example, the running cost of a helpline that I could think of are the premises, the equipment, the promotion and awareness raising, because obviously people need to know your number so they call, the support for staff and supervision, because the staff deals with a lot of very heavy situations. They listen to a lot of really heavy stories, and they do need supervision to prevent burnout. Maintenance, IT, software for data collection, which is also very important, and case management, and continuous capacity building. So thank you very much.
Thank you very much for sharing and also for suggesting what can be a priority for further funding. Do we have questions or comments from our participants, questions for our speakers?
Рачето не го стави.
Ставено?
Да. Jel mogu Višnja? Je.
Da, izvolite, Stavka.
Da, ovako. Ja pratim na sat i ja vidim da sada imamo mi samo još pola sata. Tako je. E sada, vrlo su dobro sve moje koleginice pričali iz sve zemlje, puno informacije lepih smo čuli, ali kako smo mi dobili nasoke da u stvari treba da se držimo samo za SOS telefone i pitanja koja će da budu, znači, posle diskutovana. Ja stvarno je vrlo interesantno, ali predlažem da šire, kad hoćemo, ovo je sve korisno da čujemo, treba da zakažemo još jedan ili još dva sastanka, ali zato molim sve koleginice da se držimo za ono kako smo dobili upatstva i kako smo se dogovorili. da pričamo samo za SOS telefone, za finansiranje i pitanja o kojima treba da se dogovorimo, koje treba da znamo. U stvari, da li, kaj je makedonskата verzija na prašanjata? Da, znači, to predlažem, Višnja, ja se izvinjavam, ali ako ovako idemo da pričamo i o trgovinama, i za decu, i za trafiking, i za, znači, mislim da stvarno, i za savetovališta. Mi smo dobili upatstvo da pričamo samo za SOS i za budžetiranje i za pitanja koja u stvari treba da razgovaramo tu, a ne sada sve da pričamo i kako se žrtve osjećaju i kako nasilnici pričaju i ko se javlja. Mislim, stvarno, ja u 5 sati ja moram da napustim, a hoću da budem na svu diskusiju i treba tako da se držimo.
Držat ćemo se, although I must say that gender-based violence, SOS helplines is maybe the first step for a person to report a case of violence and to seek for help. What is important for us to see is how we can maybe advocate jointly for increased funds for SOS. And maybe one rapid question for all of us. Would it be good and necessary and also needed to advocate to the ministries to provide funds? And if yes, for what? So how we can estimate that? We already heard some ideas that for maintenance of the lines, funds are provided by the ministries, but still not for staff, not for their individual development, support, then promotion of services. So in that sense, in your opinion, what would be like the top priority for funding?
Jel mogu da
Biba,
se...
please. Biba raised her hand.
Dobro. Biba.
Sačekat ću ja, ako će Savka, nije nikakav problem.
Then Savka can go first.
Dobro. Ne, ja recimo kad smo mi razmišljali o tome, zato što u Makedoniji mi imamo SOS telefon na 4 jezika. Zato što kod nas se javljaju i na makedonski, i na albanski, i na turski, i na romski. Zbog toga mi imamo 6 operatorica specijalizovanih i zato moje pitanje i do mojih koleginica za operatorice, da li su specijalizovane i jesu certifikovane operatorice, zato što to je prvi korak za rešavanje problema za žrtvu porodičnog i rodovo baziranog nasilja i zato naš predlog je da u Makedoniji, ja pričam za Makedoniju, da imamo na sve 4 jezika, ali 24 sata. Zato što sada kod nas je romkinje kad su dežurni, pa oni imaju romski, onda normalno da u Makedoniji govore i svi makedonski. Ali kad su Albanke na dežurstvo, onda oni pričaju albanski, ali pričaju i na sve druge jezike koje su. I sada kad mi pričamo o razvoju, smatramo da treba da bude na svi 4 jezika, ali da budu non stop 24 sata. I romski, i albanski, i turski, i makedonski. To je jedno od ono što smo razmišljali za razvoj, a ne idemo za savetovališta to. Mi kod nas odvajamo SOS liniju od savetovalište. I zato SOS linija je podržana od vlade Makedonije posle ratifikacije Istanbulske konvencije, a savetovalište je momentalno podržano od EU projekata. Tako da to, znači, operatorica daje savet, ali ona daje uput gde treba žrtva da ide dalje i da što brže ona izađe iz tog nasilja, od nasilje. A savetovalište je i za žrtve koje imaju momentalno i kojima njima treba i možda i dalje. Kad ona izađe iz ovog kruga, pa onda ide. A imamo i prihvatilišta, ali to su isto, ima i državne prihvatilišta, ima i iz civilnog sektora, tako da sve je to podeljeno i to je jedan kompleks koji u stvari pravi kvalitet za žrtvu što brže i što kvalitetnije izađe i normalno da sarađujemo sa relevantnim institucijama države koje rade na ovom pitanju. Zato ja, evo, najkraće koliko mogu, to ću da skratim. Ako ima pitanja.
Hvala, Savka. Biba, izvoli.
Pa ja sam htela samo da kažem da je nakon izrade posebnih standarda za rad na SOS telefonu i standarda za kvalifikacije osoba koje rade na SOS telefonu u Srbiji, znači sve ženske nevladine organizacije su i mi naravno smo mislile da će sad to da reši uveliko neke probleme, da kada se licenciramo, kad imamo standarde, kad se zna ko radi, kako radi i tako dalje, da će to da nam omogući finansiranje. Međutim, to se uopšte nije desilo, rekla sam. Znači, finansira se taj nacionalni SOS koji apsolutno ne radi po standardima Istanbulske konvencije. A sa druge strane, ove ženske organizacije koje pružaju usluge, one su ostavljene same da se snalaze. Znači, bez obzira što imamo licencu, bez obzira što mi, evo znači, mi govorim sada za mrežu SOS Vojvodina, mi imamo licencu, imamo standarde ispunjene, znači apsolutno država sve vremena govori vaši izveštaji su fantastični, znači ništa se ne dešava, 0 bodova što bi rekli, 0 bambija, država i dalje ne pada im na pamet da finansiraju ženske nevladine organizacije i sad oni jednostavno prebacuju loptu na lokalne samouprave i kažu da bi lokalne samouprave trebalo da finansiraju usluge SOS telefona u skladu sa znači, lokalnim budžetima i sa stanjem kako je na lokalu. Tamo gde imate SOS, imate, nemamo sve. Lokalne samouprave nemaju sve SOS telefone, nego se ta usluga pokriva regionalno. Međutim, opet, znači, tu dolazimo do onog pitanja zašto sad tu ženske organizacije mogu da zagovaraju. Da li da i koje su to zagovaračke uopšte aktivnosti? Ja mislim da pre bilo kakvog zagovaranja, rekla sam, i lokalna samouprava, a i ženske organizacije moraju da imaju puno više znanja i informacija šta je rodno odgovorno budžetiranje, kako, šta se finansira, da budu uključene u pripreme budžeta, jer samo na taj način, ako u tome učestvuju, pa to se usvoji, a onda se ne sprovodi, onda možemo da reagujemo, onda možemo da kažemo imate to i to, vi to niste sproveli. Znači, mislim da je sve aktivnosti na advokaciju koje smo do sada imali, bili su tako, kako da kažem, malo više ad hoc. Znači, ajde sad malo idemo kod ove lokalne samouprave, sad nam se promenila vlast, idemo sad malo da razgovaramo. Ono što je negde boljka organizacija u Srbiji, to je da mi delujemo onda kada, kako da kažem, kada su naši interesi najviše pogođeni i uglavnom delujemo naravno u interesu žena žrtava nasilja. Nema kontinuiranog advokacija, nema kontinuiranog pritiska, nema tog stalnog pritiska koji bi naterao donosioce odluka da na jedan drugačiji način pristupe ovom problemu. Tako da mislim da bi i to moralo da se promeni, da bi neke druge metode, neke druge tehnike, neki drugi načini komunikacije sa donosiocima odluka bi moralo da se negde, da razmišljamo o njima, kako bi naterali lokalne samouprave da drugačije razmišljaju o ovoj usluzi. Ja vidim takve situacije i kod nas, tako vidim sada i koleginice iz regiona šta su govorile. Znači, mi nemamo problem recimo sa pravosuđem. Mi nemamo problem čak ni sa centrima socijalni rad. Nemamo problem ni sa policijom. Oni svi znaju i ko smo i šta smo i pozivaju nas na sud, tužilaštvo, prihvataju naše dokumenta i tako dalje. Imamo silne potpisane protokole. Znači, taj deo nije problem. Problem su finansije, znači to su lokalne uprave. I tu mora da bude, opet kažem, možda da razmišljamo o nekim novim metodama i o nekim, da kažemo, inovativnim tehnikama u zagovaranju kako bi možda ostvarili, barem što se Srbije tiče, govorim za Srbiju, kako bi ostvarili taj neki veći uticaj na donosioce odluka u smislu izdvajanja sredstava za finansiranje SOS telefona.
Thank you, Biba, a lot. I have only question based on what you said, maybe for all of us. Would it be better that we have additional funds for SOS helplines from the local budget? Or it should be, because the idea in Istanbul Convention and also in what we had is merging of different organizations, although in your case of the network, so it's initiated from NGO, from women's organization, and then it is institutionalized in a way, and then took over by the ministries and funded to some point, like from maintenance. So what would be, if we want to have local funding, maybe it can be challenging for organizing?
No, I think it's, if they allocated the money from the local budget, there is more possibilities for the local organization to keep their independence. If we are financed from the national level, there is some kind of the challenge, or maybe some kind of the jeopardize the independence of the women's organization, in the case of financing from the national level. So maybe it's a better model to receive the money from the local level, to keep their independence, to keep their way of work, and not to how to say, it's always very difficult to negotiate with the government. I think it's much more easier to negotiate and to talk with the local governments on certain way, because in some small municipality or some small communities, all the people know each other, and it's very easy to communicate, to reach someone who's on the certain position, in this case, on the position in the local municipality. So maybe it's the better option, but of course, the experience in Serbia is very negative experience, just because we have that model that from the one side, government organized SOS national helpline on the national level, but that SOS is out of any kind of the control, and it's...
But I think it's a unique experience.
Yes,
it's not the case in every country, like in Bosnia and Herzegovina, they have very good cooperation, very good models, in Moldova as well, in Albania as well. So far as we heard, so Serbia is very unique in this negative approach, unfortunately. But in other cases, I don't have impression that there is a lack of funds for SOS helplines based on what we heard today. Is it the case, or there is a lack of funds, or question of, this is a question for all of you. I see Natasha here on the screen. So maybe we can share this experience as well. Are the funds you have sufficient or not? And for instance, what is priority to be funded when we are talking about combating violence against women in general? Not because SOS helplines are only the first step or first entry point for someone, or especially in COVID, it was the case. But in general, you mentioned that there is always transfer to other services because this is not enough and not sufficient. So what would be priority? Or maybe you have additional comments or want to share something. If not, maybe we are at the end. We have 10 more minutes, but we maybe already shared what we wanted. In general, I wanted maybe to mention as well that there is an initiative for tracking allocations for combating gender-based violence, not only SOS helplines, but in general. And what would be the easiest way to do it is to analyze policy and legal framework and obligations and how much money has been allocated to fulfill these obligations, and who are the institutions in charge, ministries that have mandate to implement policies. It can be done like this, but still there is an impression so far without clear numbers that battle against violence against women is still underfunded, and that we still have a huge number of femicides all over the region, and also in world, and that we really need to act more efficiently in this direction. Still, I think that we have this agreement on challenges related to data collection from SOS helplines because of anonymity and protection of privacy of callers. But maybe some additional cooperation with other institutions can be improved so that we know how efficient SOS helplines are in providing support to women, or it would be not needed. This is maybe still a question for us. And we will continue to work on this methodology and be happy to share it with you. And I'm inviting you to check out our paper about SOS helpline funding, and maybe to provide, if you have time, now during the holidays, I'm joking, but maybe if you have time to provide feedback or some additional ideas for methodology or data, we would be more than happy to do that. And we are, under the network, are working on the support of women's organizations, how to use and utilize more gender-responsive budgeting in their advocacy efforts, and how to read budgets and how to negotiate. What we would like to continue with further is to try to open dialogue or to expand the space for women's NGOs participation in decision-making about the budgets. And we really count on UN Women in this support, at least in the region and in the countries where they are lead agency for gender-responsive budgeting at the country. If there is no more question, I would like to thank you, like a really big thank you for participating in this webinar in this afternoon. And I'm glad that we had opportunity to share experiences and hope that we will continue to work on this topic further.
Bye.
Bye.
Thank